Hello everyone, welcome to our GPAT examination 1000 MCQ series. This is our course exclusively designed to crack GPAT examination. So let's get started with the first question of the day. Lead poisoning, copper deficiency and vitamin B9 deficiency can lead to. Is it anemia, myasthenia gravis, cardiac arrest or all of the above? Here, as you can see, they have noted three conditions. First one is lead poisoning, second one is copper deficiency, third one is vitamin B9 deficiency. What is vitamin B9? It is folic acid. So here we have to concentrate there is reduction or reduced folic acid, reduced copper and higher amounts of lead. So what will the condition? Is it cardiac arrest? No. In folic acid, lead and copper is not much associated with cardiac arrest. Is it myasthenia gravis? No. Myasthenia gravis is an autoimmune condition. Is it anemia? Let's check it out. Anemia means what? Anemia is the lack of blood or decreased red blood cell count. So what are the reasons for this anemia? See, there can be various reasons for the formation of or for the development of anemia. Let's check each one in detail. First one, iron deficiency anemia. We know, so as for the production of RBC, we need folic acid, iron as well as vitamin B12, that is cyanocobalamin, right? So if there is deficiency of iron, it can cause iron deficiency anemia. Second one, thalassemia. Thalassemia is a genetic condition, it's an inherited condition. Here also RBC is very low, leading to anemia. Lead poisoning. Lead poisoning, what happens is that lead inhibit an enzyme that is important for the production of hemoglobin. Okay, thereby lead poisoning or higher concentration of lead can lead to anemia. Next one is copper deficiency. Copper. Where have we studied copper? Cyanocobalamin contains copper. So reduction in the amount of copper can lead to again anemia. Next one is vitamin B9 deficiency. What is vitamin B9? It is folic acid. Deficiency of folic acid can lead to reduction in the synthesis of heme. Vitamin B12 deficiency. What is vitamin B12? It is cyanocobalamin. The deficiency can directly lead to anemia. Now, anemia of chronic diseases. Some diseases such as rheumatoid arthritis can lead to conditions such as anemia. Cancer can lead to anemia. And the last one is sideroblastic anemia, which means there will be disruption of the heme synthesis. This disruption of the heme synthesis, what is the cause for that? It is genetic, can be genetic or can be acquired. Because of this, iron will deposit in the erythroid cells, leading to microcystic anemia. So these are the many conditions. From here also questions can come. Here are the various reasons of development of anemia. Here, one more important thing is the amount of hemoglobin and the amount of the value of hemoglobin. Let's see hemoglobin. First one, in males, if it is less than 13 gram per deciliter, or in females, if it is less than 12 gram per deciliter, it's considered as anemia. The person is considered as anemic. And if the hemoglobin value is less than 0.41, this hemoglobin value represents the amount of RBC that is present in the blood. Okay. For male, it is 0.41 and for female, it is less than 0.38. So if any question comes like that, you have to note these values also. This condition can lead to anemia. So what will the answer for the question? Lead poisoning, copper deficiency and vitamin B9 deficiency. What will the answer? The answer is anemia. Right. Coming to the next question. A 100 mg drug was administered to a patient that follows zero order kinetics. Okay, if 20 mg is removed from the body in 1 hour, how much drug will be remaining after 3 hours? Okay, the initial dose is 100 mg. If 20 mg is removed in 1 hour, how much drug will be remaining in 3 hours? Let's see the options. Is it 80, 60, 40 or 20 mg? See, here we have to note one thing. That is, it is following a zero order kinetics. So there are mainly two types of kinetics that a drug follows. First one is the zero order kinetic and the second one is the first order kinetic. Whenever a drug follows zero order kinetic, it will have constant amount of drug will be removed from the body. While when a drug is following a first order kinetic, constant fraction of the drug will be removed from the body. Here it is given zero order kinetic and the initial concentration that they gave is 100 mg. So after 1 hour, 20 mg will be removed and the remaining will be 80 mg. Right? The remaining amount will be 80 mg. That is after 1 hour. Now, after again 1 hour, 20 mg will be removed and the remaining will be 60 mg. Right. Again, the third hour. In question, they have given 3 hours. Right. So, again, after third hour, again 20 mg will be removed and the remaining will be 40 mg. So, what will the answer? It will be 40 mg. Let's see if the same drug, if it is following first order kinetic and instead of 20 mg, they have given a fraction. For example, let's say they have the amount that is reduced is 50%. So after 1 hour, 50% will be removed, which means 50 mg will be remaining. Okay, again after 1 hour, 50% will be removed. That is 25 mg will be remaining. Okay, again after 1 hour, the 50% of this will be removed, which means 12.5 will be remaining. Okay, this is how we have to calculate when it comes in first order. Constant fraction of the drug will be removed. Here, zero order means constant amount will be removed. So, what will the answer for this question? It will be 40 mg, right? Because it is following zero order kinetics. Right. Coming to the next question. Drugs metabolized by acetylation. The options are sulfonamide, hydrolysine, isoniazid, and all of the above. Here, acetylation means what? It is a detoxification process, right? It is a metabolic process. Now, in all these drugs, first to answer this question, we should know the structure of these drugs, which undergo acetylation: sulfonamide, hydrolysine, isoniazid. If you note, there is something common in all these drugs. So, if we see the structure of these drugs, you can see there is NH. Here also, isoniazid, there is NH. Hydrolysine also, there is NH group. So here, as you can see, the acetyl group is getting attached to the NH position. So which is the enzyme that is used? That is N-acetyl transferase. Sulfonamide is what? It is an antibiotic. What is hydrolysine? Hydrolysine is a drug for blood pressure. And isoniazid is a first line anti-TB drug. Right. So all these drugs under the influence of N-acetyl transferase undergo acetylation process. Okay. So what will the answer? So the answer is all of the above. Coming to the next question. Which of the following alkaloidal tests give flocculated pink precipitate? Is it 5% tannic acid test, ammonium recinate test, picolonic acid test, Meyer's test? Okay, from this we should know first one, which of the following are alkaloidal tests? Is these the 4 alkaloidal tests? Yes, these 4 are used for identifying the presence of alkaloid. So which one gives a pink flocculated precipitate? Let's see each one in detail. So these are the chemical tests for alkaloids. Now, first one is drag and drop test. Drag and drop reagent is potassium bismuth iodide. Right? And the observation is reddish, orange or brown precipitate. Meyer's test. Meyer's is what? Potassium mercuric iodide. It gives a cream or white color. Wagner's test. Wagner's is I in Ki, which means iodine in potassium iodide. It is a brownish to reddish precipitate. Hager's test. Picric acid is the reagent. Right? Whenever picric acid comes, the color is always yellow precipitate. Tannic acid test. Here the reagent will be 5% of tannic acid. And the observation is buff colored precipitate. Ammonium recinate test. And the salt used is ammonium recinate. It gives a pink flocculated precipitate. Okay. Picolonic acid test. And same, wherever picolonic acid or picric acid comes, the observation will be yellow precipitate. So what will the answer? Here, the answer will be ammonium rekinate test. This is a test that gives flocculated pink precipitate. Okay. Coming to the last question. Which of the following drug class act by inhibiting the protein synthesis in bacteria by acting on the 30S subunit of ribosome? Okay. The options are cephalosporin, rifampicin, tetracycline, or sulfonamide. Here we have to note it is what inhibiting the protein synthesis. In which cell line? In bacterial cell line. In bacteria, we know the ribosome is having whatever subunit, it is 70S. While in humans, it will be 80S. Right? So it is acting on the 30S subunit of the ribosome. Okay. So here, what we should know is that each class of drug, which cephalosporin is acting on which part? Cell wall. Now, rifampicin is acting on which part? Polymerase enzyme. Tetracycline, where is it active? Sulfonamide, where is it active? Each class we should know. Let's see that in detail. The main category is cell wall, the drugs that inhibit the cell wall. Examples include penicillin, cephalosporin, teicoplanin, and vancomycin. Right? The drugs that inhibit cell membrane, that include amphotericin B, nystatin, polymycins, etc. Okay, cell wall and cell membrane completed. Coming to the ribosome, there is two subunits, 30S subunit and 50S subunit. Now here, in 30S subunit is inhibited by aminoglycosides, tetracyclines, etc. While 50S is inhibited by chloramphenicol, macrolide antibiotics, erythromycin, lingomycin, and linezolid, etc. Now, after completing cell wall, cell membrane, and ribosome, the main target comes where? The DNA. So there can be classified into two categories. The DNA gyrase inhibitors such as quinolones, aminocoumarins, etc. And DNA dependent RNA polymerase inhibitors. Polymerase is the enzyme. Okay. So that include rifampicin. Okay. Now after including all this ribosome for protein synthesis, the DNA and RNA synthesizing enzyme, and the cell wall and cell membrane, another category comes the antimetabolites. This mainly inhibit the metabolic products. These includes sulfonamide, cotrimazole, trimethoprim, pyrimethamine, etc. So here in this question they are asking about 30S subunit of ribosome. So the answer will be aminoglycosides or tetracycline. So here is it cephalosporin? No, it is not. Rifampicin? No. Is it tetracycline? Yes. Answer will be tetracycline. Hope you enjoyed the video. This is an exclusive course dedicated for GPAT training by Setu Satsavi Pharma Tutorials. Now stop dreaming and start doing. Let's crack the GPAT 2025 exam. Thank you.